Today I am going to give a brief description about the epilepsy. What is epilepsy? Myths about epilepsy, do's and don'ts about epilepsy, and in the last, epilepsy and the childhood. So first, coming to epilepsy, what is epilepsy? Actually, epilepsy is the abnormal cerebral discharges occurring in the brain. Abnormal cerebral discharges means desynchronized electrical activity. As we know that our brain is a complex organ made of many specialized brain cells. These brain cells perform electrical activity which occurs in normal pattern and responsible for the normal function of the brain and the body. Epilepsy is a disorder of the brain cells where there is a recurrent, sudden and episodic burst of excessive electrical activity which results in a change in the behavior of the person. When a seizure occurs, we call it a seizure when there is one single episode of the change in the electrical activity. But in epilepsy, when the seizure occurs again and again and they are unpredictable. Epilepsy are of two types. One, we say that generalized tonic-clonic convulsion, in which the patient has got tonic movements of the whole of the body. There is a frothing from the mouth and urinary incontinence. Patient becomes unconscious and it's a serious condition. In contrast, there is another type of epilepsy called focal epilepsy, in which one part of the body has got jerky movement. Sometimes we don't see any jerky movement, only there is a loss of consciousness. These are called partial seizure or partial seizure with generalization. So coming back to the symptoms of the seizure, what kind of symptoms we get in the seizure? So sometimes it happens that there is a staring of the eyeball, then it could be jerky movement of the arm and leg, which is most a prominent feature. Sometimes there is a stiffness of the body without loss of consciousness, tongue bite, frothing from the mouth, urinary incontinence. And sometimes there is a abnormal behavior which is called automatism, like lip smacking and other things there. So these are the epileptic manifestation which tells the patient that when to bring to the hospital. So what are the causes of epilepsy? Epilepsy has got, usually when we do the investigations like MRI, CT scan, most of the cases, like 60 to 70% of the cases, we don't get any abnormal finding in the brain. That is called asymptomatic or idiopathic epilepsy. Mostly 60 to 70% of the epilepsies are the idiopathic epilepsy. 20 to 30% of the cases, when we do some investigations, we get some abnormal finding in the MRI, and this is called symptomatic seizure. So what triggers the epilepsy? Usually these are the factors which we tell the patient to avoid, like forgetting the medicine, loss of sleep, then there is a change in the atmosphere, sometimes it happens, change in the weather also causes aggravation of the epilepsy. Then in the female it's a menstrual period. This is called catamenial epilepsy. So even the well-controlled seizure sometimes precipitates with the onset of the menstruation. Then fever, if the patient develops some high-grade fever, particularly in the childhood, febrile seizure is one of the example in which fever aggravates the seizure. And then there are few drugs which is taken and patient is prone for the epilepsy, they through seizure. So how to diagnose epilepsy? Epilepsy is the diagnosis of the clinical manifestation. Whenever you get these kind of manifestations which I have described earlier, we call it epilepsy or convulsion. But sometimes it happens that it's very difficult to see from outside. Sometimes what happens in the ICU primarily, that patient doesn't have any manifestations, but patient is not regaining the consciousness. Then it is called non-convulsive status epilepticus. In these kind of epilepsy, we need to take the help of the investigation like EEG, MRI, video EEG, 24-hour EEG, these kind of things we do to diagnose the non-convulsive status epilepticus. There are other findings like PET scan also we do sometimes for the epilepsy diagnosis, and particularly for the epileptic surgery whenever we are planning. Now coming to the treatment of epilepsy, most of the epilepsy, 80 to 90% can be treated with the appropriate medication. There are 10 to 20% of the cases in which the medication fails. Even after giving 2 to 3 types of medication, we cannot control the seizure. These are called the refractory epilepsies, and in that we need to give the multiple anti-epileptic drugs, or sometimes we need to refer the patient for the epileptic surgery also. Coming to do's and don'ts about the seizure treatment. So what we should do when a patient is diagnosed to have a seizure and when he is on the anti-epileptic therapy. So always the most important thing, you have to take the appropriate medicine on the proper timing. Missing the drug precipitates seizure. So the proper timing is very much required. Then you have to inform your family members and the concerned person where the patient stays. Sometimes for the pediatric age group, we tell our teachers, they should inform to the teachers that they are suffering from the seizure, and if he throws some seizure or seizure-like manifestation is there, he should bring to the doctor. Then there should be some identification tag. Those who is suffering from the seizure and throwing recurrent seizure, they should have some identification tag in which the name, which kind of drug he is taking, and in the emergency whom to contact. And suppose if the patient throws seizure, which hospital he should bring in, that should be mentioned in that thing. He should follow the proper sleep pattern. There should be a balanced diet. He should avoid exertion. And what he should not do, that he should not should not have the sleep deprivation. Then watching TV or mostly working on the laptops and everything where there is a flashlights are there. He should avoid working for the longer time. And most of all, the person who is suffering from the seizure and on anti-epileptic medication, he should refrain from taking excessive alcohol, caffeine, and while taking other medication which can interact with the anti-epileptic drug, he should consult a doctor while taking the other medication. Myths related to epilepsy. Epilepsy is considered as a very old age, but still in the society, even with the literate person, there are a couple of myths which are persisting and widely disseminated among the society, which needs to be taken care of. The first, it said that epilepsy is a very rare disease, which is a very wrong notion. Epilepsy is not a very rare disorder. It affects 50 million people worldwide in India, and epilepsy has been identified as a public health problem. It is found to be the second leading problem affecting the brain in both the urban and rural population. It is estimated that in India there are 6 to 10 million people with epilepsy. Second, which mostly people are confused with, that epilepsy means madness and it's a psychiatric disease. It's not a psychiatric disease, it's a neurological disease which can be very well treated with the medicine. And most of the 80 to 90% of the cases of the epilepsies can be very well cured with the medicine. Third, myths are there that those patients who is having this epilepsy, they have got abnormal behavior, they are a crazy person, they have got very violent behavior, and they are not suitable for the normal behavioral activities. So these are the wrong notion. With the children, those who is having epilepsy, it is said that they are the mentally retarded patients and they don't do well in the school, or in the later age they have got delinquent behavior. So these kind of things are not there. Sometimes it happens that many patients with the epilepsy, they are mentally retarded. But this epilepsy should not be correlated with the mental retardation. Mental retardation with epilepsy is a separate entity, but most of the patient who is having this epilepsy, they have got normal intelligence, and there are examples that patient with the epilepsy, they have done quite well in their education in their respective fields. It's also considered as sometimes people think that it's a curse of God. This is not the case. It's a medical illness and it should be cured. There are other myths are there that it spreads with the touching, coughing, or it happens with if you're staying with a person having seizure disorder, you'll also get seizure. So these are not the cases. These are not the infectious disease. There are a couple of these foods which aggravates seizure. So this kind of like onion or other food, it's not kind of food available in which aggravates the seizure. And that there are this misconception that epilepsy cannot be cured. Once epilepsy is there, whole of the life you have to take the medicine. This is not the case. In most of the epileptic treatment, after giving the medicine for 2 to 3 years, if the scans are normal, we can stop the medication. Only 20 to 30% of the cases in which seizures are not good control with the medicine, we have to continue it for the longer time. Otherwise, most of the cases, we can cure the patient within 2 to 3 years. Then regarding the female, particularly that marriage, we should not tell to the husband, or we should not tell to the this in-laws family that the person is suffering from the seizure disorder, which is a very bad misconception, because sometimes the patient with a fear, they stops taking the medicine, and the moment she goes into the in-laws house, they throw seizure. So this should not happen, and they should be properly conveyed to the message properly should be conveyed to the husband and the in-laws. So the message for the society is that epilepsy is a disease which should be treated accordingly, and if the proper medication is given, most of the epilepsy patients, they can be cured, medicine can be stopped. There are few patients in which the long-term medication is required, but it's a treatable disease. Always come to a neurologist if you have seizure or seizure-like symptoms. Don't think that it's a curse of God and it cannot be treated. It can very well be treated.